All right, good evening, everyone. Thank you so much for joining me for this webinar tonight. For those of you I haven't met yet, yes, my name is Dr. Sarah Bourne. I started at Barton back in September, so I've been here almost a year now. And I'm one of the pediatric providers at the community health clinic, and I also work in the hospital. As you can see, I'm in the clinic right now, so perfect setting for this webinar. But I just wanted to say before I start as well, it's been a pleasure to work at Barton so far and to care for your children. So thank you for entrusting me and the other pediatric providers with your children's care. I really wanted this webinar tonight to be as helpful as possible for everyone. So I spoke with some of the other providers in our office and we came up with a list of kind of frequently asked questions that we get during visits and different common concerns we see a lot in clinic to focus this conversation on tonight. So hopefully this is all very practical and useful information for you. And again, I am still physically in the clinic, so hopefully there isn't too much background noise, but definitely let me know if there is, or if there's still an echo or anything like that. So I have no real disclosures, no financial disclosures or anything like that to share, but I do have a wonderful 2-year-old daughter pictured here. Her name is Avery, and definitely having my own child has affected or influenced the care that I provide. And you may hear me talk about her during our visits together, but this is her in that photo. So here's kind of a summary of what I'll be talking about. As you can see, there's a lot to cover, so I plan on keeping things at a pretty high level, but I'll do my best to leave some time for questions at the end. And as mentioned, please chime in with questions throughout, and I definitely recommend you reach out to your child's primary care provider if you have any questions that are really specific to your child or if there's concerns that you have. But I'll be talking a bit about different vitamins, when they're indicated, how to promote healthy eating, some dental health topics, common sleep questions, common infections we see. I will touch on measles and some child development topics as well, signs of depression, especially in teenagers, and then some injury prevention things at the end. So again, a lot to cover. But one of the most common questions we get in clinic is, should my child be taking vitamins? And the good news is that most kids actually don't need any supplemental vitamins. As long as they're eating a varied diet, they're likely to get as much of the nutrients as they need, even with just a few bites of food, given that most vitamins that we need are stored in the body over time. Even for picky eaters out there, many foods are fortified with vitamins, like cereals, for example. However, there are some vitamins that kids are at risk of being deficient in during the course of their childhood, and I'll touch on some of those tonight. So, vitamin D, actually, we think about 17% of teenagers are likely low in vitamin D, and 15% of kids younger than that. Vitamin D is very important for bone health. It helps the body absorb calcium and phosphorus, which are also necessary to build strong bones. It also helps with our immune system. And actually, there's some linkage with mental health. So, low vitamin D levels have been linked to poor mental health, especially increased risk for depression. In infants, they need about 400 IU, that stands for international units per day, unless they're taking 32 ounces of formula. And then for teenagers and school age children, they need about 600 IUs per day. Um, and so the way that we get vitamin D, definitely diet is one way. A lot of foods are fortified with vitamin D, like milk, cereal, orange juice, yogurt. It's naturally found in some of the foods pictured here on the slide, like different types of fatty fish, egg yolk, mushrooms, sardines. I'd say a lot of people, especially kids and teenagers, are probably not eating a lot of those foods. So, one of the reasons we see that vitamin D can be low. And then our body actually uses UV light to make its own vitamin D. So sun exposure as well is important for vitamin D production. But again, most people aren't actually getting enough through their diet or getting outside enough. And so we do see that this is a relatively common vitamin deficiency. Iron is another big one. So iron is very important. It's one of the key building blocks for hemoglobin, which is what carries oxygen in the red blood cells in our body. Infants are born with more hemoglobin than what they need, but it slowly decreases and reaches a low point at around 6 to 12 weeks of life. And there's very little iron that comes through breast milk. So babies that are only drinking breast milk, we do recommend they either start iron containing foods around 4 months or some supplemental iron. And then babies that have certain risk factors like prematurity may need that even earlier. And then because of this, we do screen all children at a year for iron deficiency anemia. We do a hemoglobin screening clinic where we do a finger poke to see. Toddlers are also another age group that are at risk of having low iron if they're drinking too much milk or super picky eaters. So we often think about that in that age. And then I didn't list it here, but also menstruating teenagers as well, just with the menstrual cycle can be at increase of having low hemoglobin and have higher iron needs. So again, most kids, if they're eating meat or eating lots of leafy greens or iron fortified foods are okay, but it is something we screen for and look for. And then a special note on vegetarian and vegan diets, just because of the difference in how protein and some vitamins are absorbed through plant-based foods. Children who eat a vegetarian and vegan diet likely need more protein, zinc and iron specifically. And then for vegan diet, calcium, vitamin D, and B12 can be harder to get through the diet. So we do typically recommend supplementation with those vitamins in those specific types of diets. Healthy eating, I feel like this is a huge topic, not only in childhood, but throughout our lifetimes. It's very difficult to eat healthy, hard to have healthy options available, but some kind of tips and tricks to help promote it in your home. Definitely starting early. Toddlers are notorious picky eaters, and sometimes they need to try a food 10 or more times before they enjoy it. Having it be a family effort. So having meals together as much as you can, being a role model for your children of modeling the healthy eating and lifestyle choices you want them to have. And then this is a big one, making sure you really only have healthy choices available in your home. So if there's a certain food you don't want your child to have, like soda or certain junk food or snacks, trying to keep that out of the house. Media-free meals as well. So people have looked at when families sit down and eat together without phones or TV, kids tend to eat healthier, have healthier relationships with food. And then offering healthy snacks, watching portion sizes, things like that. Getting creative, making it fun, cooking with kids, shopping for food with kids, growing vegetables if you have, the time and space to do that. For picky eaters, trying to hide vegetables in different ways, like in the pasta sauce or in smoothies, lasagna, cutting things into fun, interesting shapes can sometimes be enticing. Talked a little bit more about cooking more. So definitely cooking more tends to be healthier, eating at home, eating more whole foods, less processed foods. And then reading labels. This is sort of a big one. A lot of foods have, especially processed foods, have kind of sneaky sugars added. So foods like ketchup and peanut butter oftentimes have sugar added. So trying to buy versions of those foods that don't have extra sugar added and being mindful of different baby food snacks and toddler snacks. Sometimes they have added sweeteners as well. Obviously, this is a lot of different ideas, and some of these things are harder to do than others. Some are more expensive than others, but especially if you're a single parent or a dual working household. So I always say kind of starting small, what is feasible for you and your family based off of those factors. And then certainly some good cost saving measures are buying frozen fruits and vegetables or canned vegetables. They're just as nutritious, making sure there's not too much added sodium. but otherwise just as nutritious as fresh fruits and vegetables. Cooking more versus eating out is generally healthier too and saves money. Buying and cooking in bulk, buying generic brand, and eating more whole food, less processed food too, or other kind of money saving measures and ways to eat healthy. But again, it's very family dependent what works for you guys, but these are kind of some tips or tricks that work well for some families. And this little chart on the slide just talks about kind of roughly like the food groups and servings per day based off the age range of what kids should eat. Definitely, I think the hardest thing is vegetables. Having kids eat enough vegetables a day is hard across a lot of age groups and even for adults, I think. Switching gears, dental health. This is a big topic. Even though we aren't dentists, we do a lot of dental health screening in pediatrics because childhood cavities are relatively common and can cause a lot of other related health issues down the line. So, of course, dental hygiene, I'm sure we all know this, brushing twice a day is very important. Some pediatric specific things. For infants, once they have teeth, trying to avoid night feeding if they need it for growth or medical reasons, trying to wipe or brush their teeth after can help decrease risk of cavities. Really, if it's related to nutrition as well, avoiding sugary foods and drinks can help decrease risk of cavities. Transitioning from the bottle to a cup or sippy cup at 12 months helps as well. And then if your kids are eating sugary foods, trying to have them brush their teeth after can help. Regular dental visits. We say after a year, if your child has teeth, then that's a good time to start going to the dentist, have them get used to getting their teeth checked, catch cavities early, apply fluoride, and then at least every 6 months after that, or more often if they do have cavities or other dental issues. I wanted to touch on fluoride. So this graph kind of shows like how fluoride helps protect the teeth against cavities, but it's a naturally occurring mineral that can help prevent cavities by strengthening and protecting the teeth. It strengthens the enamel, which is the hard outer layer of the teeth. And so that helps protect against those cavities and it helps rebuild minerals that are lost due to acid breakdown. So whenever we eat, we make acids, including in our mouth, and that can break down the enamel in our teeth. So fluoride helps rebuild that. Community water fluoridation is recommended actually by nearly all public health, medical, and dental organizations. Then this is because it's been showed to decrease tooth decay by 25% and is actually considered one of the top 10 public health measures in the US since 1975. And at this point, about 3/4 of counties in the US have fluorinated water as of 2012, just because, again, it's been shown to really decrease rates of cavities and has been shown to be safe over time. But there is no fluoride in the water here in South Lake Tahoe or Douglas County. I'm sure you've heard us all say that by now on a visit. And so extra important to brush teeth with fluoride and see the dentist and get the fluoride varnish to help get that benefit. Definitely people wonder and talk a lot about the different risks of fluoride. The most common is the enamel changes. So you can get some white streaking of the enamel from fluoride, which is cosmetic in nature. Very high doses can be toxic, but these are in much higher doses than exist in any water supply in the US. So toxic doses are 5 mg per kg of body weight. So, and that's milligrams per kilogram. So that would mean a 155-pound adult would need to consume 120 gallons of fluoride at once to have a toxic effect. So, and that's definitely way, way, way more than kids are ever exposed to. There's some concern about the effects on IQ or neurodevelopment over time. The data and evidence that we have right now don't show any causal pattern, just association, and again, at much higher levels than what kids are exposed to in public water sources. So some of the studies are from other countries where there's been higher doses of fluoride in the water, and then they monitored over time this association. But again, much, much higher levels that are in any of the fluoride in the or the water in the United States of fluoride, and certainly much more than exposure through toothpaste or things like that. And then we do offer the fluoride varnish at well child checks to all kids that are 5 and under if they have teeth. So that helps a bit too, because I know it can be hard to get into the dentist or if your child's under 1 as well. Sleep. This is sort of just a brief touch on sleep, but sleep is super important for everyone of all ages. Regular sleep deprivation can lead to some pretty difficult behaviors and health problems like difficulty concentrating, irritability, headaches, and even depression. And certainly, kids who get enough sleep have healthier immune systems, better school performance, improved behavior, memory, and general mental health. So, very important for learning, development, mental health, and the immune system. You can start promoting healthy sleep as early as infancy, starting with kind of a healthy bedtime routine, making sure you're getting enough sleep. For sleep hygiene, kind of the biggest things are avoiding screen times an hour before bed. I think starting that expectation early is really important. It's harder when kids are teenagers and certainly as adults as well. Related to that, modeling those healthy sleep habits for your kids. Having a pretty regular daily routine. Obviously, I know we're in the summertime and most people's routine gets different in the summertime, but as we're entering or approaching the school year, trying to get in a good habit, starting the school year with that. And then physical activity during the day also helps with sleep at night. And then, recognizing some sleep problems early. So, difficulty falling asleep or staying asleep or snoring are certainly things that we recommend that you come and chat with us about if your child's experiencing that. But this kind of shows over the years how much sleep kids should be getting. It definitely decreases as they get older, but I see a lot of teenagers, and definitely there's a lot of teenagers out there not getting quite enough sleep. So, um, trying to help with that as much as you can. Okay, avoiding illness. If you have children, especially in daycare school, you'll know that kids get sick a lot. And unfortunately, that means that we get sick too often as parents or those who care for kids. Most colds or infections that children get are from viruses, and there are more than 200 viruses that circulate that we know of that can infect humans. So lots of opportunities to get sick. On top of that, they mutate, which is why it seems like kids and their parents can get endlessly ill. And unfortunately, the reality is when kids are in daycare school, they're just going to be exposed to a lot more viruses and bacteria, and it can be hard to prevent illness entirely. But certainly, some ways to help prevent illness is hand washing definitely helps prevent the spread of illnesses. Encouraging kids to avoid touching their mouth, nose, or eyes unless they just wash their hands. Wearing masks can definitely be helpful in preventing the circulation of viruses that are spread through respiratory droplets, like flu, for example. And then vaccines are certainly effective in preventing the illnesses they're made to protect us from, but we don't have vaccines for all the viruses and bacteria that are out there. And then there is some evidence, which I sort of alluded to in the last slide, that healthy sleep, healthy diet, and exercise can help our immune systems fight off infections better. But kind of given how common it is for kids to get sick and how many viruses and bacteria are out there, I also want to spend some time talking about some of the kind of common infections that we see in pediatrics, and that I'm sure you've seen in your kids, and kind of when to reach out to us for help. So the common cold or upper respiratory tract infection, this I'm sure we have all had many times in our lives, presents with stuffy nose, runny nose, cough caused by viruses. Sometimes these viruses, like the flu virus specifically, can affect multiple body systems and cause other symptoms like vomiting, diarrhea, and muscle aches. The symptoms do typically self-resolve, meaning the body will fight off the infection on its own without any medication specific to target that virus. And supportive care is what we tend to recommend, like staying hydrated, sleeping, treating symptoms. Cough, we often get questions about cough and cough medicines. We don't typically recommend any of the over-the-counter cough and cold medicines for children for two reasons. One, there isn't a lot of kind of data that they help, but also some of the active ingredients in some of these medications are more likely to cause side effects in kids. But using honey over the age of 1 can be helpful for cough. Sometimes a cold can then evolve into a bacterial infection. So this is why we always, if we see your child for a cold, we say definitely come back if they get a new fever or new symptoms like ear pain or new or worsening cough, trouble breathing, things like that. That could be a sign that they have a new or secondary bacterial infection. Ear infections, super common. So sudden onset of ear pain in older kids or new fussiness, nighttime wakenings or poor eating in infants. This does peak actually between like 6 to 12 months, and that's because as this photo shows, you have something called the eustachian tube, and in infants, it's more, you can see it's kind of more horizontal than in adults, where it's more vertical and drains better. So it just creates more collection of fluid in the inner ear, and bacteria can grow in that poorly draining fluid. So definitely if you notice those symptoms in your child, especially if they had a recent cold, then we'd want to see them. And family history and frequent infections are kind of the most common risk factors for that. Molluscum, super common in kids. We've been seeing it a lot this summer. It is caused by a virus, and it shows up as these little these ones are really red, but sometimes they can be pink or the same color as the skin with this kind of central dimpling or bump in the middle. They can be itchy, red, and swollen at times. And both the good news and the bad news is that they do go away on their own without treatment, but it does take 6 to 12 months for a lot of kids. So it's unfortunate we don't have a lot of great effective ways to treat it at home. Trying to treat them at home can sometimes spread them. So we generally avoid or recommend avoiding scratching or touching them and letting them ride their course. If your child has this and it's super bothersome to them, like really itchy, there are some treatment options or in a location like the face. And if they're in school, we recommend that they wash their hands frequently, have the bumps be covered at school, and to avoid sharing towels or clothing, because again, they can spread pretty easily across the body and between people as well. Conjunctivitis or red eye infections, also very common. This is very tricky because it can be difficult sometimes to tell, especially if the pink eye is from a bacterial infection or viral infection, but some clues. Allergic is usually both eyes. Viral kind of classically starts as one, spreads to the other, but I will say bacterial does that too, so it's sort of tricky. With viral, these kids often do have a cold as well at the same time, so that can kind of be a clue. With allergic, their eyes are often itchy, and then the discharge is often white, not like thick and goopy. Viral or bacterial can be thick and goopy, so again, it can be hard to tell. If you have any concern, definitely come see us, and we're happy to help. And then allergic red eye is usually kids over 2. Kids under 2 typically are too young to have developed like environmental allergies at that point. But whether it's bacterial or viral, both are pretty contagious. So having your kids wash their hands a lot and everyone else at home wash their hands a lot too if this is going around. Last infection, strep throat. So this one also, I'm sure everyone has had experience with at some point, but symptoms are usually sore throat, fever, usually no cough, runny nose, stuffy nose. Kids especially can also get stomach pain, headache, painful lymph nodes in the neck. So that's another sign that it might be bacterial over a viral cause of a sore throat. If they also have cold-like symptoms, again, it's probably a virus, but when in doubt, always bring them in. We're happy to see them. Thankfully, this is really uncommon under kids who are under 3. It's more the school-aged kids and teenagers. And then kind of classically, you see these big red tonsils with pus, but sometimes the tonsils are just red and swollen, or they can have these little red dots in the back of the throat too. We do treat this with antibiotics for a few reasons. One, it prevents against the chance of it progressing to something called rheumatic fever, which is an inflammatory response to certain strains of the strep bacteria. And that inflammatory response can affect the whole body, like the joints and the heart. And so we definitely don't want kids to get that complication. It also decreases the chance that the bacterial infection spreads to other body parts and reduces the spread of strep throat to others. So when can my child return to school when they're sick? I feel like this is also a common question and sometimes hard to know. These are kind of general guidelines. So fever-free for 24 hours, diarrhea-free for 48 hours, symptoms improving. If they were started on antibiotics, we want to see them on antibiotics for at least a day. And then as long as the symptoms aren't interfering with your child's ability to participate in school activities, then generally they're safe to go back. And this is just balancing the risk of getting others sick with also the importance of going to school. School's super important for children's emotional wellness, academic outcomes, future health outcomes. So we try to balance getting to schools back as soon as it's reasonably safe for them and their peers to go back. There are exceptions to these guidelines for certain infectious diseases. So like, for example, pertussis or whooping cough, kids have to stay out of school for longer. So again, if you're seeing us for a sick visit, definitely always ask this question about when they can go back to school. And we're always happy, of course, to write school notes too. Measles, I feel like I can't talk about infectious disease and illness these days without talking about measles. As I'm sure many of you have seen in the news, we're in the midst of significant increase in measles cases. So my slides are a little out of order here, but as of August 5th, there's been over 1,300 confirmed cases of measles across 41 states, including California. 92% of those cases are in people who are unvaccinated. 65% of cases are in children. 13% of those people have had to be hospitalized due to complications from measles, and there's been 3 deaths so far from measles complications. In the early 1900s, about 6,000 people a year died from measles. It was super pervasive. Basically, everybody got measles in their lifetime. And then after vaccination became available in the early 60s, rates steadily dropped. Measles was actually declared eliminated from the United States in 2000 due to the vaccine. And so you can kind of see over time, I guess this is the best one you can see. There were very few cases. And then since 1990, when the second dose of measles vaccine was introduced and recommended, there's been very little cases, and this is the most cases that we've had since then. And then there's been a lot more cases this year than in the last few years, is kind of what this graph shows. Thankfully, we haven't had any in El Dorado County, but there have been cases in some neighboring counties like Tuolumne, Sacramento, and Placer County earlier this year. And, I always share with my patients, our town is definitely at higher risk for an outbreak. Ideally, vaccination rate should be above 95% to create that kind of community-wide protection. But our county has one of the lowest vaccination rates in the state, actually, where we've had fewer than 80% of kids fully up to date on their vaccines going into kindergarten. So we're keeping a close eye on this. Definitely we're having a low threshold to test people for measles, and thankfully we haven't had any cases, and hopefully it stays that way. Why do we worry about measles? So first of all, it's super contagious. It's considered one of the most infectious diseases that infects humans. So it spreads through the air when an infected person coughs or breathes. And someone could actually get measles just being in the room where someone else with measles was up to 2 hours later. So that's how long it hangs out in the air. And if someone with measles, if you had measles, for example, 90% of the people who are not immune have been in any close contact with you will actually contract measles. So pretty infectious, and kind of shows like people could still easily get infected or exposed, even if your kids aren't in school, just being out in the community. The other kind of tricky thing about measles is at first it sort of looks like other colds. So it starts with high fevers, then followed by cough, runny nose, red, watery eyes, and then the rash shows up. So people are actually infectious 4 days before the classic rash appears, which is also this sort of tricky thing about it and why we get these big outbreaks. So this is kind of a classic measles rash. It usually begins as flat red spots on the face and at the hairline, and then it slowly spreads downward to the trunk, arms, legs, and even the feet. And so this is kind of what it can look like. This is a photo of a child with the measles rash on their trunk. The reason why it can cause these high rates of hospitalization, even death, is that it can lead to pneumonia, and it can also infect the brain, so it can cause encephalitis as well. Really the only way we have to protect against measles, I guess I'll say, is the vaccine, and it's pretty effective, 93% effective in preventing measles infection after 1 dose, 97% after 2 doses. It takes about 2 to 3 weeks to work. In the United States, we recommend routine vaccination at a year and 4 years, but certainly earlier in the case of active outbreaks in the community. Switching gears to development, this is one of the main things we check at all of our those annual well child checkups. We do developmental surveillance at all checkups for all kids, where we look at your child's motor, fine motor, language, social, and cognitive development. We do more formal screening for developmental delays at 9, 18, and 30 months, and then we screen for autism at 18 and 24 months, or sometimes 30 months. The CDC actually has a lot of really great tools that you can use to assess your child's development at home. So including this app here, the CDC Milestone Tracker, and they have some online quizzes too. Healthychildren.org also has a lot of great links to different resources for developmental assessment tools that you can access as a parent, such as the American Academy of Pediatrics Motor Delay Tool. But if you have concerns in between well child checks, definitely something to see your pediatrician about. Some things we definitely want to know about or concerns, or if your child has any regressions or back steps in any of the milestones. So for example, my child was talking a ton and suddenly they aren't, or if they have differences in strength or muscle tone between sides, any sudden weakness or changes in their gait, like they're suddenly falling a lot more, things like that, or a sudden change in their personality or mood are definitely things we'd want to hear about sooner between well child checks. Sort of related, but in the teenage space, around depression, I feel like this is unfortunately very common. There's some stats that show about as many as 1 in 5 adolescents experience depression at some point during their teenage years. And it's a tricky thing because sometimes it can be hard to realize it's going on until it's been going on for a while. But the two most common symptoms in teenagers are definitely more sadness or irritability than usual, or not enjoying activities that used to make them happy. So, if you have a teenager who's becoming more withdrawn from the family or their friends, not doing things that they used to really enjoy doing, like certain sports or activities, if they're a lot more irritable, those could actually be signs of depression. Definitely trouble sleeping also can show up as a sign of depression, school difficulties, changing in eating habits, like poor appetite or less healthy eating, spending more time on their phone, less time with family, friends, less energy or motivation, things like that, taking less interest in their personal grooming or appearance, or sudden substance use concerns too. Those can all be signs of depression. So we definitely treat depression in our clinic. So definitely if you feel like you've noticed this for more than 2 weeks, make an appointment. And some other things you can do is definitely ask them directly how they're feeling, if they're concerned that they have depression, listening to those feelings without judgment. having them get into counseling, doing some safety planning. And so that's specifically if you have concerns that your child might hurt themselves or having suicidal thoughts, and really trying to focus on strength and supports. And promoting and helping them with different things that help with mood symptoms, like getting outside, exercise, healthy eating, spending time with friends, things like that. But again, if you have any concerns about that, definitely recommend they be seen. We can help place referrals to therapists or counseling. We also start medications like antidepressants in primary care. And then, we provide an actual additional layer of support and follow up and can help with some of that safety planning. And of course, in, severe cases of depression where there are suicidal thoughts, and if inpatient hospitalization is necessary, we help facilitate that as well. And then we also do screening for different potential hormonal, metabolic, or autoimmune causes of depression as well. Like thyroid dysfunction, for example, can be a hormonal cause of depression that we can do testing for. And then here are some important resources like the National Suicide Prevention Lifeline and Crisis Text Line. Kind of the related to that, promoting resilience. I think this is an important part of childhood development as well. And I kind of like this framework. This is from Dr. Ginsburg, who's an adolescent medicine doctor. He talks about the 7 C's of resilience. So competence, helping kids build a sense of knowing they can handle situations effectively. We can help promote that by focusing on their strengths, allowing them to make decisions on their own. Confidence, that's related to that, and just focusing on the best in each child, highlighting those strengths, helping them build that belief in their own abilities. Connection, close ties to family and community, that leads to a sense of security and helps with resilience as well. Character, having a personal set of morals and values, so modeling these as a family and then kind of promoting kind and caring behaviors and actions. Contribution, that feeling of importance of personal contribution to society helps with resilience as well. Certainly coping, learning healthy coping mechanisms. This, as parents, a big thing is modeling those coping strategies, helping guide kids in developing their own healthy coping, and avoiding kind of shaming when there is unhealthy coping, but helping kids kind of understand and recognize when they might be engaging in unhealthy coping and trying to guide them in more healthy ways. And then control, helping children and teenagers build an understanding of their own sense of control. That actions do produce certain consequences, and most things that happen in life are actually the result of our choices and actions, and helping kids build that kind of sense of control over their life as well. Okay, so the last big topic is around injury prevention. I'm going to kind of speed through this a little bit because I'm seeing I'm short on time, but this is a big thing, and it's something that I feel like we, or at least I, could talk more about in clinic with patients. But the reality is actually that injuries, or like unintentional injuries, is the most accidental injuries are the most common cause of death in children in the United States. This is kind of shows like the key causes of death, but as of 2022, firearm related injuries were actually the most common cause of death in children, followed by motor vehicle crashes. So just kind of briefly on firearm safety. As I'm sure we're all aware, firearms can be very lethal. 1 in every 4 firearm injury results in death, and so we do recommend certain tips and strategies to prevent firearm injury and death. Certainly, safe storage of firearms. They should be locked without ammunition, never left unattended. If you don't have firearms in your home, but you may know that your child's friends' parents do, or if you're uncertain, the AAP does recommend, asking parents of the homes where your child visits or is cared for if they do have any firearms and how they're stored. Again, just making sure they're stored safely. And then making sure all adults in a home with firearms take firearm safety training course. Unfortunately, the reality is that people have studied this, and even kids that have been trained to not touch firearms are naturally kind of curious. and will pick them up if they find them. So making sure all the adults are kind of aware of firearm safety is really important, as kids are kind of at greater risk of being harmed by a firearm, either by themselves or a family member, than being injured by a stranger. So kind of keeping them away from kids is the best way to keep them safe. And then with adolescents too, this is true for adults as well. Just kids can be struggling quietly with depression and anxiety, and so access to firearms is linked with higher rates of suicide. And so just being aware of that if you have teenagers, and teens are particularly impulsive. So again, bottom line, just making sure they're safely stored. Car safety, this is a big one. Motor vehicle crashes, really important that kids are safely restrained. So this is a kind of nice graph that shows by age, roughly if they should be rear facing, forward facing in their car seat, when to transition to booster. Kind of some highlights. Always look at your specific car seat and what it recommends, because they often have kind of weight limitations. So following that, these are rough guidelines, but following the weight limitations on your specific car seat. And then the safest place in the car is the back seat. So having your kids stay in the back as long as you can, but certainly at least until they're 13. And then when you move them to a booster, out of the booster, the key is making sure that they're tall enough that the seatbelt fits properly, so that it is snug across the upper thigh, not the stomach, and the shoulder is across the shoulder and chest, not the neck or the face. Water safety, this is a big one. We live in Lake Tahoe. There's a huge lake, lots of water. This is very unfortunately common cause of injury, death in younger children, the toddler age. So being very mindful of this. Kind of highest risk of drowning is that 1 to 3 year old age. And people often think about pools and large bodies of water, but unfortunately, bathtubs, buckets, hot tubs are also a risk as well for drowning. So the key is prevention, making sure kids are always supervised when they're near water, wearing life jackets, having there be physical barriers if you do have a hot tub or pool. And then you can start swim lessons. They're definitely recommended older than 1. I know that there's some swim lessons available for toddlers too. And then toddlers and teens are at highest risk. For teens, it's more related to kind of impulsive, dangerous kind of decision making, or if there's alcohol or other substances involved. And then last, we're going to talk about bike safety and brain injuries. So traumatic brain injuries, this includes both brain bleeds and concussions. Concussions are a specific brain injury caused by kind of rapid acceleration of the brain. We see these a ton. Definitely they can be bike accident related, skiing related, but even just sports related. See a lot of soccer concussions, basketball concussions. The symptoms often include headache, nausea, balance issues, difficulty with memory and concentrating. I feel like here at Barton, we have a really good interdisciplinary concussion team and work really closely with the schools to help kids, recover and safely get back to activities and sports. But it is very important, if you're at all concerned that your child might have a concussion, or if you've been told they do, to do brain rest. So sleep breaks from computers, rigorous schoolwork, avoiding sports, and just allowing the brain to really heal and recover, and kind of a gradual, slow return to activity as guided by a healthcare provider. Helmets don't prevent concussions, but they're very good at preventing really catastrophic brain injury and bleed. So definitely anyone who's going on anything with wheels, bike, scooters, skateboards, skiing, anything really where there's a risk you could fall and hit your head, should wear a helmet. Best way to protect your brain. And then this image here is from a CDC website called Heads Up, which I think is really great. They have a ton of information and resources on concussion treatment, prevention, healing, stuff like that. So it's been a super evolving, kind of the evidence and guidelines around it have changed a lot in the last few decades. But I think that this website is really helpful and up to date. So I know I just talked about a lot of kind of like scary injury sort of related things, but biking, swimming, stuff like that, a lot of kids in Tahoe do a lot, but ultimately these things are really good for health and well-being. Obviously, there are risks associated with anything that we do, but overall, we're very lucky to live in a place where kids have really good access to the outdoors and ways to get outside and be active. And hopefully those slides just kind of demonstrate different ways that, we as parents and as a community can help mitigate the associated risk with these activities that are actually super important, like biking and swimming. And overall, I feel like Tahoe is a great place to raise kids, to be very healthy and well. And with that, that definitely concludes my talk. Here are some resources. I know that they're kind of small, but kind of in summary, I definitely recommend healthychildren.org as a great resource. The AAP, that's the American Academy of Pediatrics, they also have some parent-facing materials, which is really helpful. For vaccine information, I really like CHOP. They have a vaccine education center. We hand out some of this information in clinic to families. And then the CDC also has a lot of different really helpful child, pediatric, and family related health information as well. And then here are all my sources, and then about 10 minutes for questions. And then also, I welcome your feedback. This is my first webinar. I would love to hear about which things were particularly helpful, if there's anything that you want to hear more about in future articles or talks from our team. We're happy to help. So thank you all for your time and for being here tonight.
Thank you so much. I just want to remind folks that if you do have questions, you can ask them there's a Q&A box located at the bottom of your Zoom screen if you kind of hover towards the bottom, or you can just enter it into the chat. There's an anonymous button if you'd prefer to ask anonymously. I did receive a couple in advance, but please make sure you go ahead and ask. The first one was just asking about summer and kids. Is it common that kids are more dehydrated, especially when they're outside? It's hot. My son has been complaining of a headache, a little bit of nausea. Just wondering if that's maybe the source of it, or if we should bring him in to see if it's something more.
Yeah, definitely could be. And I know it's been really hot too the last couple weeks. So definitely when it's hot and outside more in the sun, drinking more is super important. Um, One kind of way to tell if your child's dehydrated is how often they're peeing and kind of how concentrated the urine is. That's something I don't know, depending how old your kid is, obviously, if they're teenagers, they, might not willingly show you, but always asking, like, kind of what color was the urine, and that's like a way to encourage. And then two, if you're sweating a lot, you're not just losing water, but also electrolytes like salt. And so different drinks can be really helpful. Like I know people often drink Gatorade. Gatorade is pretty sugar heavy, so I recommend more electrolyte based drinks like Pedialyte, for example. It has more salts, less sugar, but that sort of can help too if it is dehydration related. But the kind of how often they're peeing and how dark or concentrated their urine is going to be your big clue to see if it's dehydration related.
Great. The next question is asking, I'm sorry if I misunderstood, but you're saying with a cold, we should just wait it out for the body to fight the cold unless there's a high fever, then give over-the-counter medications?
Yeah, so most colds will go away on their own. Certainly, if your child's having trouble breathing, we want to see them. If they're having a fever that lasts for 5 or more days, or if they're having kind of severe pain like ear pain, for example, or throat pain. And then the other big one too is hydration. So depending on the age of the kid, like infants and toddlers, when they're not feeling well, often won't drink enough to stay hydrated. So that's the other kind of big thing. But yeah, the majority of colds will go away on their own, and then it's just about supporting your child through the symptoms so that they can, rest and recover. but definitely treating fevers. Fevers are super. I don't know if I had a fever as an adult recently, and I was reminded how miserable it is, and especially kids when they have fevers, they don't want to drink, they can't sleep. So we always recommend taking your child's temp and recording the temperature because we'll always ask about that, but definitely treating the fever with Tylenol or ibuprofen if they're old enough.
Right. There's, I think, a follow-up question. What about congestions from having a cold?
Yeah, that's so common. And I find it's even worse up here. And I sort of think it's related to how dry the air is. So, you know, when you have a cold, you have a lot of congestion, it stuffs up the nose. But then with how dry it is up here, it often dries out that congestion and mucus and makes it even harder for kids to clear it out. And then, especially the younger kids, it can create these kind of hard, like, congestion mucus plugs almost in their nose and make it even harder. So, treating the congestion can be really helpful, help with improved sleep during colds and just overall comfort with breathing. Humidifiers are helpful. So especially during sleep in the room where your child's sleeping, having a humidifier going, hot steamy showers before bed can be helpful. So if you just turn the water really hot in the bathroom, close the door, let the steam build up, and having your child sit and just breathe in that steamy air, that can help clear that congestion. And then in younger kids, like infants, using some sort of suction device. One common example people use is like the nasal Frida suction to help clear that out. Because if your child's too young to be able to blow their nose well on their own, then definitely all that congestion and mucus is going to make it a little harder for them to breathe and definitely harder to sleep. So those are kind of and then nasal saline too helps kind of break up that mucus and makes it easier to clear it out as well. But those are kind of some supportive things that you can try at home to help with that congestion as your child's recovering.
Great. I think this is the last question, but if I see any others come in, I'll be sure to ask. Regarding puberty in boys, is there any tall tale signs of when they are in puberty?
Yeah, that's a great question. I like talking about puberty. If you've met me in clinic, I usually start talking about it at 9 because some kids can start to have signs. So for boys, the first signs typically, so every people can be slightly different, but typically the first sign is actually testicular enlargement and penile length enlargement. Those I feel like are more subtle and people don't often notice those first. I think realistically, most people often first notice changes in the body odor. So it gets stinkier, growing hair in new places like the armpits or in the pubic area. And then definitely changes in moods and feelings. So having new feelings, bigger feelings. I think those three are the ones that people tend to notice first. But like technically, for the majority of boys, the first thing that happens is that change in the testicular size. And then later comes the kind of acne, voice changes, facial hair, things like that. But most people tend to notice those the body odor, feelings, mood changes, um, and the hair in new places first. And then about 1 to 2 years after those things start, then that big growth spurt in the height happens.
Great. Fascinating. Well, I haven't seen any other questions come in. I think you covered it all really well. Really appreciate you being here tonight. For those that are interested in watching this again, we have recorded it. It will be on our YouTube channel as well as we'll put it up on our Facebook page. I don't know if the presentation was blurry for anyone else, but if you do want to see them, I'm happy to get the slide deck from Dr. Bourne and send it to anyone that's interested, so that you can take a look at all that great information. And then just as a final note, we always send out a post survey and love to hear your feedback. How did we do tonight? And if you have any upcoming topics you want to hear from us, we would love to hear more and see about scheduling those specialists. But I think it looks like we can give you back 3 nights or 3 minutes in your night, and Thank you, Dr. Bourne, again for being here. We really appreciate it. I hope everyone enjoys the rest of your evening.
Thank you, everyone. Good night.